Doctors of Reddit, what's the biggest case of faking it you've ever seen? 30y/ a woman came to the ED with such excruciating belly pain. Paralyzed. Oh god, it hurts when you press there. Must have oxycodone now. ED doc said if she can get out of the ED bed and do 20 jumping jacks, we can give her the oxy. She did 20 jumping jacks, then got kicked out of the ED. My mom's a nurse and she said once some crazy lady came in and complained that she had the whooping cough. And whenever she coughed she followed it with a loud whoop. My cousin got glasses. Her 7-year-old little sister also wanted glasses because she thought it was so cool to wear them. So she started telling her teachers she couldn't read what was on the chalkboard, and squint at home, and go incredibly close to the TV to watch things because she said she couldn't see things clearly. Her parents got worried and took her to the doctor. She read everything wrong on the vision test. Everyone seemed convinced that she needed glasses. But the doctor was a little concerned because the tests indicated she needed really thick glasses. And usually that wasn't the case unless there was a family history of vision issues. Her parents both had 20/20 vision. And her sister only had astigmatism. They all realized she was faking it. So the doctor told her parents in front of her that she needs some pretty intense eye surgery so she'd be able to see without glasses. They even wheeled in a machine to make it convincing to say they could do the surgery right then and there. She freaked out, confessed to faking it all and started to cry. She got grounded for a while. I'm a NICU and a nurse. We get a lot of malingering in the earth. One day, one of our frequent flyers came in and started faking a seizure in triage. Now obviously I know this lady and she fake seized 1,000,000 times before. But this time it's in the lobby in front of about 30 people, who have no way of knowing that it's fake. She's lolling around on the floor making a damn fool of herself and folks look horrified. I walked up to her and said calmly, "Karen, what are you doing?" To which this genius responds, "I'm seizing." I told her to stop seizing. So she did. Edit. No, her name wasn't actually Karen. I just did that for confidentiality. When I was a kid I learned I could fake sick and get out of school. So 1 to 2 days a week I would get a migraine, and hold my head and complain and I would get to go home. Eventually my parents took me to a neurologist who said maybe you just don't let him eat chocolate and sugar. I admitted to faking and was grounded for a long time. Had a patient when I was an intern feigning blindness. She would constantly be playing on her smartphone, only furiously trying to hide it when someone from the care team came into her room. The best was when my attending one day strolled past her room and threw his hand up in a highly exaggerated "hello" wave. She started to throw her arm up to but caught herself halfway through, then threw her hand back into her lap and pretended to be staring off into nothing. The patient claimed to have all kinds of illnesses and would cough every minute or so. Have you tried coughing when you don't need to? It's like a normal cough but you take the subwoofer away. Now imagine that, but 10 times more fake. Ophthalmology technician. People pretend to be blind all the time. Go to check their eye pressure with the Tinapin, a device you poke them directly into the eye with, and they go, "What the fuck is that thing?" When I was a kid, I would plan my sick days way ahead of time. Had an old thermos that I would pour leftover milk, meat, whatever. Leave it on the windowsill in my bedroom just letting it fester for a month. Of course the thermos was closed so no smells escaped. I set an alarm for the middle of the night, dumped the contents of the thermos on my rug and ran in to tell my dad I was throwing up and so sick. However, this thermos monstrosity filled the entire condo up with horrible smells and both me and my dad ended up pucking into the tub at the same time every time we tried to clean up the rug. He had to take the day off work too. Needless to say, I never pulled that again. Years ago I had a patient who had been rear-ended in an auto accident a few weeks before I saw her. She had a history of lupus. She was decked out in the usual crippled paraphernalia: crutches, neck brace, elbow braces, wrist braces, knee braces, and could barely walk. I saw her a couple of times and she showed no improvement. One Saturday I was on call but had to take a back streets route to the hospital because of an event taking place on the main thoroughfare. I apparently drove through her neighborhood because, wonders behold, there she was wearing old lady spandex power walking down the sidewalk, holding weights in both hands. I did not call out to her. Next week, she was back in clinic, with her crippled get-up on again. A few weeks later I got the subpoena for the deposition, and it all became clear. No doctor, but a funny story from work a couple years ago. Guy calls in sick for around 8 days, says on the phone he is really sick, comes back to work the next week, tanned as F. This dude hands a medical slip to the manager written in Spanish. On the slip there is an official seal from some random Cuban clinic. And #XB. Guy walks over to B with a grin on his face saying, "Yeah, I'm probably fired." He was fired. Not a doctor but a nurse once had a patient having a seizure. The other a nurse and I knew she was faking it. He said as much. She suddenly stopped seizing, miraculously, looked straight at him and yelled, "Shut up, fat boy." He and I laughed so hard. He, the other nurse, was referred to as such, fat boy, for few months after that. At least she wasn't having a seizure. Edit. Spelling and clarification. My mom was an emergency room nurse. Years ago they brought a prisoner from the local pen in who seemed to be unconscious. The guards were suspicious that he was faking it. They checked his vitals and everything seemed to be okay. The attending doctor tried poking him in the foot with something pointy. Nothing. Then he got an idea. They took a rubber hose and inserted it in the back of his throat as if they were intubating him. That did the trick. He sat up very quickly, coughing and gagging. Edit. Yes. Sternum rub. Got it. 4th year medical student. On my rotation and the trauma came in from a woman that had been arrested. During the drive the patient banged her head 4 times against the window of the police car and then went unresponsive. She came to us with a bruise over her forehead and unresponsive. We all smelled BS, but the patient was a great actor. Didn't even flinch during the digital rectal exam, which is standard for all patients that come in through the trauma bay. Though some of the nurses said that they caught her peeking at us when we'd leave the room. We ended up getting a CT scan, which was normal, and was even considering intubating her to secure her airway when our attending finally walked over to her, opened her eyelids and held them open while telling her to wake up. Finally she started fighting to close her eyes and the jig was up. The doctor called her out and she proceeded to start screaming at us. She was much more pleasant when she was pretending to have a brain injury. Sorta along the same idea. Working at a pharmacy we saw a guy come in to try and get a refill on some pain meds that had no refill. After pleading that his ear really hurt we told him again we couldn't refill it. One of the other employees saw his step into a side hallway and take a pencil and jam it forcefully into his ear repeatedly, drawing blood. He calmly left and went to the ER. He came back a few hours later with a prescription for pain meds. I'm not a doctor but a nurse. There was a geriatric patient taking advantage of the call bell, because she was an attention seeker. She always needed really basic things to get done for her because she thought the place was a hotel. It was a rehabilitation ward, and we should try to motivate patients to do as much for themselves as possible. She would ring the bell for reasons like "please lift the blanket up for me," or "please pass me my phone," or "please feed me," and claimed that her hands didn't work. I caught her several times lifting herself off the bed with her hands, grabbing her phone when it rang. You get the gist. After days of saying no and that she needs to start doing things for herself, she grew more and more frustrated. Eventually she snapped, grabbed me by my collar, shook me aggressively and yelled, "What don't you understand about the fact that my hands don't work?" I didn't know what to tell her. I just looked at her and blinked as she slowly released her death grip off me. I guess I healed her hands. Praise the Lord. 1 upvote equals 1 prayer for an old lady's arthritis. My brother was an M for 2 years and he told me this. People will try to use the ambulance as a means for transportation from Fulton to Oswego, because the hospital is in Oswego, by faking seizures. Sometimes when the head guy was feeling fun and knew that the person was faking, he'd say something like, "Man, it's weird that he's having seizures but not peeing himself." Apparently the person would kind of snap out of it for a second, weigh up the repercussions, then either pee themselves or stop faking. I thought that was hilarious. Not a doctor but nurse. I once read a specialist's consultation report, and at the end of the report the actual diagnosis given was fictitious ailment. Deleted. Posted this before but. Minus male patient, 18 years old, rolled in unconscious. Mom says he's been like that for the past 4 hours. Go to check his lungs when I hear something interesting. I place the stethoscope near his mouth and hear him breathe in normally, but then breathe out by saying, "Breathe." No joke. Male patient, 21 years old, admitted with inability to speak for last 2 hours and respiratory distress. Lungs clear, but we hook him up to oxygen for a few minutes. After he's taken off, his father comes running and drags me over, saying his son's tongue refuses to go back in after receiving the oxygen. I look at the kid, and he's seriously just lying there with his tongue poking out like a child. I tell them to push it back in. A few hours later the dad tells me the boy is convulsing. I go to see without making my presence known, and he's lying there just fine. The moment I ask the mom how he's doing, he starts convulsing. Think of an odd version of the worm, but on his back. Female patient, 16 years old, admitted with complaints of recurrent seizures and frothing from the mouth. I look at her and she is literally blowing spit bubbles. I check her reflexes. Everything is intact. The moment I turn away to check on another patient, she suddenly becomes rigid, and the spitting intensifies. Male patient, 30 years old, unconscious and completely unresponsive for 6 hours. This guy was totally dedicated to his act. I initially approached it as a stroke, but when the blood pressure, reflexes, pupils, etc. all are normal, I start checking pain sensation. He slowly began to open his eyes and groan as I asked him to tell me his name, but the moment his Achilles tendon was pressed, he suddenly sat up, stated his name, and declared himself cured. Female patient, 17 years old, complained of respiratory distress and convulsions. Everything's normal on admission, and's conscious but refuses to eat. Parents are worried out of their minds, and every few minutes she has a fit, where she would just basically shake from side to side. She let slip to a nurse that she didn't want to go to school that week, so she was faking an illness. Since she was refusing to eat, the attending wrote up an order for a nasogastric tube, which was inserted and then removed by her in a matter of minutes. Subscribe, like and comment if you hate outros. Begging you to subscribe, like and comment.